Hi, I am Dr. Mamta, pediatrician and neonatologist at Cloud9 Hospital, Sarjapur Road, Bangalore. So, how does breast milk impact the development of a growing brain in a preterm baby? It is the first choice of milk in a preterm baby, mainly because also of its composition. So, breast milk of a preterm baby will be higher in proteins, lower in lactose and fat, which is specifically made for a preterm baby. Early exposure to breast milk, it will alter the growth and function of the growing brain. So breast milk, it helps for the growth of the brain in the means of structure and function. Also, it has some non-nutritive factors like oligosaccharides, hormones that will enhance the brain growth. How does this impact on a later half? We have seen babies who are breastfed. Later on, they will have better academic school performance. They will have an higher IQ, and there is a reduction of ADHD symptoms in such children. So now, how do we give breast milk to our extreme preterm babies? So initially, when the babies are small and they are on oxygen support, so we cannot give direct breastfeeding for such babies. So initially, they will be fed by a tube. We call it tube feeding, where the milk directly goes into their tummy. And as the baby grows older, once they cross 32 weeks. Now, why 32 weeks of corrected age? Is because until 32 weeks, their sucking, swallowing and breathing is not coordinated. So once that coordination between baby sucking the milk, swallowing and the breathing comes only after 32 weeks, after which we can start oral feeds. So a few days there will be a combination of tube feeding and feeding by a palada. And once baby is taking palada feeds, we also start something called as a non-nutritive sucking, where a baby feeds on an empty breast of the mother just to practice the sucking and swallowing. Then direct breastfeeding, once a baby is sucking well on the breast, direct breastfeeding can also be initiated. At home, once we discharge preterm babies, we usually tell direct breastfeeding. Also along with that, extra palada feeds, because the baby's sucking strength, the muscle strength is not very good, where they will not be able to fulfill their requirement only by direct breastfeeding.